Hi. Good evening, Senator Mellott, Representative Cornfield, and distinguished members of the Education and Cultural Affairs Committee. My name is Julie Anderson. I live in Leamington, and I'm requesting you vote to oppose LD798. I am an RN, currently working as a home health nurse. My previous position was in a hospital setting. And while there, I cared for a woman in her 70s who received the flu vaccine and within 24 hours had developed Guillain-Barré syndrome. The CDC admits that GBS is a potential risk associated with the influenza vaccine. GBS is a rare disorder in which a person's own immune system can damage their nerve cells, causing potential muscle weakness and sometimes paralysis. My patient initially experienced lower limb muscle weakness that eventually developed into paralysis. She was admitted to the intensive care unit and placed on a feeding tube and ventilator to stay alive. Although she eventually recovered after a month of hospitalization and therapies, she had residual muscle weakness and pain as she continued with therapies and nursing care at my hospital. You've heard it a lot today. I'll say it again. There is risk involved with any vaccine, and where there is risk, there must be a choice. Personally, I have received the flu vaccine one time in my life. I was in bed for 5 days. I could barely get up to use the bathroom. I have never been so sick in all my life, and I will never again get the flu shot. But if this bill passes, I can first see in the near future state law mandates for flu shots for all healthcare providers. If so, I would be forced into getting the flu shot to keep my job, a complete violation of my constitutional rights. I would not comply, and so would then be forced to quit my job. I would have to move my husband and our 3 publicly educated children out of Maine and look for work elsewhere. Can Maine afford for RNs and their families to move out of the state? We already have a nursing shortage. In 2015, the RN shortage was 600. A report issued by the Center for Health Affairs and Maine Nursing Action Coalition projects a nursing shortage of 3,200 RNs by 2025. This growing shortage is putting a strain on medical institutions and their employees while threatening patients' future quality of care. It is a well-known fact that Maine is not graduating nursing students quickly enough to meet the already growing demand, and if this bill passes, will certainly deter more nurses from seeking employment here. Is this really what we want for Maine? If this bill passes, I will no longer feel welcomed here in Maine and will be forced to move to a state where individual rights and freedoms are encouraged. I implore you to maintain the rights of all Maine people and oppose LD 798 in support of LD 987. Thank you.
Thank you very much. Are there any questions? Thank you very much.
Thank you.